Hello everyone. Welcome to HeInfo channel. My name is Daisy. As you know, hyperlipidemia is very common. 93 million American adults, age 20 and older, have a total cholesterol count above the recommended limit of 200 mg per deciliter. Hyperlipidemia, high cholesterol, that's not treated can allow plaque to collect inside of your body's blood vessels, atherosclerosis. This can bring on hyperlipidemia complications that include heart attack, stroke. In this video, let's find out Pravastatin, a medicine used to treat high lipid blood levels. What is Pravastatin? What kind of drug is Pravastatin? Pravastatin, sold under the brand name Pravachol among others, is a statin medication. It is exactly an HMG-CoA reductase inhibitor, which is used together with diet to lower lipid levels and reduce the risk of cardiovascular events, including myocardial infarction and stroke. Pravastatin has the origin from Streptomyces carbophilus. It has the 6-alpha-hydroxy acid form of myostatin in the chemical structure. Pravastatin was firstly approved in 1991, becoming the second available statin in the United States. What is Pravastatin used for? Pravastatin is indicated for primary prevention of coronary events hypercholesterolemic patients without clinical evidence of coronary heart disease. Its use includes the reduction of risk on myocardial infarction, undergoing myocardial revascularization procedures and cardiovascular mortality. As well, Pravastatin can be used as a secondary prevention agent for cardiovascular events in patients with clinically evident coronary heart disease. This indication includes the reduction of risk of total mortality by reducing coronary death, myocardial infarction, undergoing myocardial revascularization procedures, stroke, and stroke/transient ischemic attack, as well as to slow the progression of coronary atherosclerosis. The term cardiovascular events correspond to all the incidents that can produce damage to the heart muscle, including the interruption of blood flow. As adjunctive therapy to diet, Pravastatin is used in patients with primary hypercholesterolemia and mixed dyslipidemias, including hyperlipidemia type IIA and IIB. Patients with elevated serum triglycerides, including type 4 hyperlipidemia. Patients with heterozygous familial hypercholesterolemia in patients over 8 years of age with low-density lipoprotein, LDL, cholesterol higher than 190 mg per dl after diet modifications, or LDL levels higher than 160 mg per dl and familial history of premature cardiovascular diseases, or at least 2 cardiovascular risk factors. In patients that do not respond adequately to diet, Pravastatin is used to treat patients with primary dysbeta-lipoproteinemia, type 3 hyperlipidemia. Dyslipidemia is defined as an elevation of plasma cholesterol, triglycerides, or both, as well as to the presence of low levels of high-density lipoprotein. This condition represents an increased risk for the development of atherosclerosis. Who cannot use Pravastatin? Pravastatin is contraindicated in patients with documented alcoholism, a hemorrhage in the brain, significantly low blood pressure, liver failure, liver problems, acute kidney failure, decreased kidney function, a condition with muscle tissue breakdown called rhabdomyolysis, memory loss, high blood sugar, pregnancy, a patient who is producing milk and breastfeeding, muscle pain or tenderness with increased creatine kinase, metabolic syndrome X, immune-mediated necrotizing myopathy. What are the side effects of taking Pravastatin? Common Pravastatin side effects may include muscle or joint pain, nausea, vomiting, diarrhea, headache, or cold symptoms such as stuffy nose, sneezing, sore throat. In rare cases, Pravastatin can cause a condition that results in the breakdown of skeletal muscle tissue. This may lead to kidney failure. Call your doctor right away if you have unexplained muscle pain, tenderness, or weakness, especially if you also have fever, unusual tiredness, or dark-colored urine. Let's deeper in the detailed information of Pravastatin. Pharmacodynamics. The action of Pravastatin on the 3-hydroxy-3-methylglycerol coenzyme A, HMG-CoA, reductase produces an increase in the expression of hepatic LDL receptors, which in order decreases the plasma levels of LDL cholesterol. The effect of Pravastatin has been shown to significantly reduce the circulating total cholesterol, LDL cholesterol, and apolipoprotein B. It modestly reduces very low-density lipoproteins, VLDL, cholesterol and triglycerides, while increasing the level of high-density lipoprotein, HDL, cholesterol and apolipoprotein A. How does Pravastatin work? Pravastatin is a specific inhibitor of the hepatic HMG-CoA reductase in humans. The inhibition of this enzyme produces a reduction in cholesterol biosynthesis, as HMG-CoA reductase activity is an early limiting step in cholesterol biosynthesis. The inhibitory mechanism of action produces a reduction in cholesterol synthesis, which in order has been observed to increase the number of LDL receptors on cell surfaces and an enhancement in receptor-mediated metabolism of LDL and clearance. On the other hand, Pravastatin-driven inhibition of LDL production inhibits hepatic synthesis of VLDL, as the LDL is the precursor for these molecules. Half-life. The half-life of Pravastatin is quite short, only 1.8 hours. What does Pravastatin do for a person? For the treatment of hyperlipidemia in adults, the recommended starting and target dose is 40 mg per day, administered on a once-a-day schedule, without regard to meals. Should Pravastatin be taken in the morning or night? The antioxidant profile of Pravastatin is better when the drug is administered in the evening rather than in the morning. Not only that, many statins work more effectively when they are taken at night. This is because the enzyme which makes cholesterol is more active at night. Also, the half-life, or the amount of time it takes for half the dose to leave your body, of some statins is short. Thank you for your listening. Don't forget to like, share, and subscribe for HeInfo channel if you like this video.